So we've discussed personality in the past, previous lecture, but the idea here is when there's personality traits that result in significant distress, social impairment, problems at work, problems at school, they're considered a personality disorder. So this part of the lecture is going to be an introduction to personality disorder. I'm going to review personality disorders that are found in the DSM-V, and then very briefly talk about the validity of personality disorders. Okay, so I've given a previous lecture on personality, but just to review, when we're talking about personality, we're talking about each person's characteristic manner of thinking, feeling, behaving, and relating to others. Okay, some people are introverted, they're quiet. Other people are extroverted, they're more active and outgoing. Some people are conscientious, they're responsible. Other people are not at all, they're undependable. So when we're talking about personality traits, we're referring to these characteristic and routine ways of thinking, feeling, and relating to others. Okay, so it's useful to review the personality traits that we've learned so far in this class. So we know from a previous lecture that there's literally hundreds of different personality traits. However, all of these traits can be organized into the broad dimensions that are referred to as the five-factor model, which we can remember using the acronym OCEAN. Now, recall that personality traits are thought of as a continuum. And that means that the trait can go from low to high with all different intermediate values possible. And most people, when they take personality surveys and inventories, they score in the middle. Okay, so one doesn't simply have a trait or not have it, but really we possess our traits in varying amounts. But it's often useful to describe these broad personality factors in terms of thinking about, well, what are the two ends of the continuum? Okay, so for example, openness is defined as the tendency to appreciate new art, new ideas, new values, new feelings, new behaviors. So if we think about the two ends of the continuum, an individual who is high in openness might be described as imaginative, creative, open-minded, whereas somebody who is low in openness, in other words, closed, might be described as practical, routine, rigid, or closed-minded. Okay, so similarly, conscientiousness is the tendency to be careful, on time for appointment, to follow rules, to be hardworking. Somebody who's high in conscientiousness might be described as perfectionistic, organized, efficient, reliable, and dependable. However, somebody low in conscientiousness, it would be known as disinhibited. Okay, so disinhibition is that very low end of conscientiousness. And so people high in disinhibition, in other words, low in conscientiousness, would be described as lazy, negligent, haphazard, disorganized, careless, and even hedonistic. That is kind of ignoring responsibilities and seeking only pleasure and fun. Okay, extroversion is one that we're familiar with. So this is the tendency to be talkative, to be social, to enjoy other people. People high in extroversion, they're the life of the party. They're social, they're outgoing, they're talkative. However, they can also be described as dominant, as forceful, assertive, and even daring. So somebody low in extroversion is, of course, introverted. And we describe introverts as quiet, shy, passive, but even withdrawn, perhaps cold, or even aloof. Agreeableness is the tendency to agree and go along with others rather than to assert one's own opinions. Somebody who is agreeable is a very cooperative person, tends to be trusting of others, is honest, is humble, but perhaps some of the more negative qualities might be that they're gullible or even naive. At the opposite end, so if we're talking about somebody who's very low in agreeableness, they would be high in antagonism. So people that are highly antagonistic are skeptical, cynical, suspicious, And at their worst, they're manipulative of others, they exploit others, they're greedy. Okay. Finally, neuroticism is the tendency to frequently experience negative emotions. Okay, like anger, worry, sadness. So people that are high in neuroticism tend to be fearful, angry, bitter, pessimistic, worried, helpless, fragile. Again, we're talking about a very extreme end here, right? So most of us are more towards the middle. Um, but we could talk about alternatively, people who are low in neuroticism would be described as emotionally stable. Okay, so these are people that are relaxed, unconcerned, even-tempered, optimistic, in control, just unflappable, like nothing bothers them. Okay. Okay. Now again, I've just described these broad dimensions in terms of the two ends of the continuum, and I really do want to emphasize that most of us, while we might score towards a higher end or towards a lower end, we're not at the very, very extreme end, right? So I've described kind of like almost like two types of people, but as either being open versus closed, most of us fall somewhere in the middle. But it's important to be familiar with these personality traits because several common personality disorders, which I'm going to review in just a little bit, we can think of as having very high, what I would call extreme levels of one or more of these traits. So if we take our kind of normal personality traits and then we think of people that have very extreme levels of them, that's when we end up with a personality disorder. So what constitutes a personality disorder? Again, it's when a personality trait results in significant distress for the person, impaired social relationships, difficulty at work, difficulty at school. So basically, when personality traits result in diminished functional capacity, we've got a disorder. And so a personality disorder would be a collection of personality characteristics that lead to distress, social, or occupational dysfunction. Personality disorders are identified using the DSM, which provides a common language and standard criteria for classifying as well as diagnosing these disorders. And so I'm going to review some of the most common personality disorders that are in the DSM. Now, each of these disorders that I'm going to describe, or I should say most of them, we can think of being a constellation, really a combination of maladaptive personality traits rather than just one particular personality trait. Okay, so the first one is avoidant personality disorder. So people with this disorder exhibit a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. So we've previously learned about social anxiety disorder. So you can think of avoidant personality disorder in a very similar way. But again, to kind of link it back to our personality dimensions, somebody with avoidant personality disorder might be extremely high in introversion, so much so that they're socially withdrawn. They also might be, I'm sorry, let's just say high neuroticism, not low, high neuroticism. So that they'd be very anxious, apprehensive, a high degree of worry. Okay, so you can think about a very anxiety, a worried person that is also a very strong introvert would potentially be diagnosed with avoidant personality disorder. Extreme fear and hypersensitivity to the evaluation of others. Dependent personality disorder is a pervasive and excessive need to be taken care of. And so this leads the person to be submissive and demonstrate clinging behavior and fear of separation. Okay, so if you've ever had a relationship where the other person in the relationship would be described as extremely needy or clingy, they might have a dependent personality disorder. For the most part, this is a combination of being very high in neuroticism, including being anxious, worried, uncertain, pessimistic, helpless, um, but then also being so high in agreeableness that it's maladaptive. So, including being gullible, being meek, being subservient to others. Okay, so in combination, this creates a dependent personality disorder. So, people with this disorder have difficulty making everyday decisions without an excessive amount of advice and reassurance from others. They might need others to assume responsibility for the most major areas of their life. They might have difficulty expressing disagreement with others because of a fear of loss or of support or approval. So again, you can see where this is this maladaptive agreeableness. It's nice to be around agreeable people who don't have strong opinions and that don't assert their opinions and are just happy to let other people make choices. But when it becomes so maladaptive that they can't make their own decisions, and that when coupled with high neuroticism, so that they're anxious and worried all the time, this creates somebody that you could see would have a lot of difficulty in their social relationships. Antisocial personality disorder uh, refers to people that may be calculating, manipulative, untruthful, and irresponsible. So this is really a pervasive pattern of disregard and violation for the rights of others. Okay, pervasive pattern of disregard and violation of the rights of others. Okay, and so people might be aggressive, destructive, involve breaking laws, rules. It's really a precursor to kind of a criminal behavior. So these are folks that are very low in agreeableness and are therefore high in antagonism. So being high in antagonism means being dishonest, manipulative, exploitative. Really just think about somebody that has no mercy. No mercy for other people. Also low in conscientiousness. So if conscientiousness is being responsible, low conscientiousness means being irresponsible, being immoral, making rash decisions, also being hedonistic, so not wanting to do responsibilities or earn it, but just rather, get pleasurable things right away. So, symptoms to be on the lookout for would be a blatant disregard for right and wrong, persistent lying to others in order to exploit others, being very hardened or callous, cynical and disrespectful of others. But people with antisocial personality disorder might also use charm or or their intelligence to try to manipulate other people for personal gain. They might be arrogant and have a sense of superiority over others, but really, to be having recurring problems with the law, criminal behavior. It can result in aggressiveness towards other people, destruction of property, theft. Really talking about serious violations of rules and the law at the extreme antisocial personality disorder. Really criminal behavior. We have previously learned about obsessive-compulsive disorder. So obsessive-compulsive personality disorder would be a pervasive pattern of preoccupation with orderliness, perfectionism, mental and interpersonal control. So people with this disorder may be controlling and exhibit workaholism and perfectionism. And so this is a disorder that is kind of thought about as just kind of originating just from one of the five factors, which should be extremely high and maladaptive levels of conscientiousness. So while we might think that somebody who is conscientious takes care of their responsibilities, is organized, is dutiful, is efficient, but this can result in these out of control levels of workaholism and perfectionism. And really, we've talked about obsessive compulsive before, but when taken to a personality disorder, we can think of people having to be so perfectionistic or such a workaholic that large chunks of their day are taken up by engaging in these behaviors. And so it gets in the way, it causes significant distress, and actually gets in the way of kind of regular functioning. Borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and affect. It is often marked by impulsivity. So people with this disorder have difficulty controlling their emotions, may be prone to anger, destruction, and have a fear of abandonment. Borderline personality disorder is largely a disorder of neuroticism. So people with borderline personality disorder are emotionally unstable, get overwhelmed, extremely angry or rageful, but can also be depressive and at times self-destructive. So signs and symptoms might include an intense fear of abandonment, even going to extreme measures to avoid separation or rejection from others, having a pattern of unstable, intense relationships. Okay, so whether that's with romantic partners or whether that's with friends, but they might idealize somebody at one moment and then suddenly think that that person is like the worst person on earth. There can be rapid changes in self-identity and self-image. So having these shifting goals and values, they see themselves as bad, or even it's often been described as not believing that they exist as a person at all. There could be periods of stress-related paranoia, loss of contact with reality, impulsive and risky behavior, such as gambling, unsafe sex, spending sprees, binge eating, drug abuse. There's often suicidal threats or threat of self-injury. And then, mood swings that can last for hours or days, inappropriate intense anger. So really, this could be quite a challenging personality disorder to treat. It is treatable with psychotherapy. In subsequent lectures, we'll talk about treatments for all of these, but most therapists say that this is one of the more challenging ones to deal with. Schizotypal personality disorder is a pervasive pattern of social and interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships, as well as having perceptual distortions and eccentricities of behavior. So people with this disorder feel uncomfortable in social situations and are withdrawn. However, they also have strange ideas and are often suspicious of other people. So schizotypal personality disorder includes traits from 4 of the dimensions, including neuroticism. So these folks are very high in neuroticism, which would include social anxiousness and social discomfort, are very high in introversion, so socially withdrawn, are unconventional. Okay, so this would be like high openness, but so much so that they're odd or even eccentric or have strange ideas. And then finally, they're also high in antagonism, particularly that they are suspicious of other people and other people's intentions. So schizotypal personality disorder might include these symptoms. So one, kind of being a loner or having a lack of close friends outside of the immediate family. Often flat emotions or limited or inappropriate emotional responses. Of course, persistent social anxiety. Incorrect interpretation of events. So feeling like something was actually something that's actually harmless could be like offensive or have direct personal meaning for them. Peculiar, eccentric, or unusual beliefs, suspicious or paranoid thoughts, doubts about others. Can also have a belief in special powers. Okay, so you can see where this starts to border on some of the schizophrenia type symptoms. Dressing in peculiar ways, in a particular type of weird speech patterns, like rambling oddly. Okay, so certainly not full-blown schizophrenia, but this starts to border on some of the symptoms associated with schizophrenia, and so this is a schizotypal personality disorder. Okay, a narcissistic personality disorder would be a pervasive pattern of grandiosity, okay, in fantasy or behavior, a need for admiration or a lack of empathy. So people that are narcissists tend to be quick to react to anger. They have an extreme need to be held in high regard, and they need to seek recognition. They can also be authoritative. So narcissistic personality disorder includes traits from several of the dimensions as well. So narcissists are high in neuroticism, particularly reactive anger. Okay, so reacting to others in anger, as well as having a strong need for admiration. That would be like an insecurity. That's where that comes from. Being high in extroversion. Okay, so in particular, like exhibitionism, needing to be the center of attention. Being high in antagonism. Okay, so again, low agreeableness, high antagonism, which would be this sense of arrogance, entitlement, and a lack of empathy towards others. They're also high in conscientiousness, but in the specific subdimension of being, they seek recognition for accomplishment. So acclaim seeking, we could say, okay? So not all of the features of conscientiousness, but kind of that specific dimension of seeking accomplishment and needing to be recognized for it. Signs and symptoms of narcissistic personality disorder can be, one, an exaggerated sense of self-importance, okay? So being the center of one's universe. Having a sense of entitlement, requiring constant, excessive praise and admiration, expecting to be recognized as better than others, even without achievements, exaggerating their own achievements and talents, being preoccupied with fantasies about success, having power, being beautiful, finding the perfect mate, basically believing that they're better than other people and that they can only associate with people that are equally special, monopolizing conversations, belittling other people that they think are inferior, taking advantage of others to get what they want. Several of those symptoms are present in people that are narcissists. All right, so those were the personality disorders. In terms of the validity, that is, what do we know to be true about these personality disorders? Very little is known about the specific causes. In other words, the etiology for most of these disorders. Because each personality disorder represents a constellation of personality traits, the etiology, which again is the set of causes, for each syndrome involves this complex interaction of different neurobiological vulnerabilities. So you can think of people have this weird, complex interaction with other people, their environment, with events. There's risk factors, there's predispositions, but then how these disorders develops is this complex interplay between all these things. So it's complicated, I guess, would be the short of it. What do psychologists know? One thing is that personality disorders have childhood antecedents. And the reason is that they see a consistent pattern in people that have personality disorders with things like childhood trauma, childhood abuse, and as if, for example, these things are very frequently linked to the development of borderline personality disorder. Okay, trauma and abuse in childhood, borderline personality. Personality disorders are stable across the lifespan. and that personality disorders are also linked to various components of the brain. So, for example, antisocial personality disorder is generally considered to be the result of the interaction between a genetic disposition to have a low amount of anxiousness, to be aggressive, to be impulsive, as well as growing up in environments that might be urban environments where you had to be tough, to have inconsistent parenting, to have poor parental role modeling and peer support. So there's these genetic kind of predispositions that then get manifested in specific environments. Okay. With another example, borderline personality disorder is generally considered to be the interaction of the genetic disposition to have negative affect, but then that interacts with a very difficult childhood environment that would include abuse or parents that were very uncertain or invalidating of the kid, the child. Okay, so again, the specific causes of each disorder, they're hard to know and track down, but we can say that there's these three characteristics that are common to each. Okay, so that is it.